Okay, so today's topic. Today we're going to talk about some tips for choosing a new EMR. So this topic was chosen because, as we all know, Wolf has announced that they will be sunsetting. And so this has put Wolf clinics in a situation where they need to choose an EMR. So this can be a very daunting task, and I'm hoping that today's session helps a little bit with that. Okay, so an introduction to your EMR user group leads. So Becky Tague, who is an EMR specialist from South Calgary PCN, and myself, an analyst at the AMA's ACT team, we both lead this user group. So we come up with topics with your help, and we organize the sessions for you. And so what will our agenda be today? So we'll start with some welcome and introductions. We'll do a quick whiteboard activity just to get back into the swing of things. Then we'll go through some of the tips for choosing a new EMR. Then we'll talk about some additional resources that you can use to dive into these tips in more detail. Then we'll have a discussion and question and answer period with the whole group. And finally, we'll talk about our next meetings and what to expect there. So let's say you're working with a clinic or you're in a clinic and suddenly you have to choose a new EMR. We're going to use the whiteboard to share maybe some tips that you might think that clinic might need. So maybe what are some first steps? What are some things they might want to start with? And you can draw on your own experience. You can make things up. Yeah, get creative here because we've come up with some tips, but we've probably missed some things. So we want to hear from you first. Plan, yes, that's a huge one. Thank you. Yes, you don't want to just pick any EMR and just go for it. You definitely need a plan. This is a huge project, right? So treat it like a project with a project plan and make sure everyone's on board. Think long-term, not just short-term. Yes, absolutely. I love that. Yeah, this is going to be something you will be using for a long time. And we at the AMA like to say the EMR should be the hardest working member of your team. So this is a big decision. Yes, so think long-term. Schedule a demo with vendors. Love that. Yes. And choose several vendors. So this is a great place where you can ask questions to the vendors, actually see the product live, find one that meets your needs as a clinic. Yes, every clinic's different. So pick an EMR that suits your needs. Write down your must-have requirements. I love that too. Yes, there are definitely things that every clinic needs based on their workflow, the patients they see, the types of providers they have. So those are the things that you need the EMR to fit. EMR features, yes. What kind of EMR features do you need in the new EMR? Chat with other EMR users, yes. Get those experiences from other people. Those are invaluable. You'll probably hear things that you wouldn't hear from the vendor themselves. Cost, that's a big one. We'll touch more on that later today. There's definitely a lot that goes into that, some different things to consider. Ask the vendor for free information sessions. I love the word free in there because yes, those sessions should be free. Don't let them charge you for those. Analyze cost session needs long-term. Yes, we'll also touch on that. That's a great point. It's not just the cost up front. There are longer-term costs to consider as well. Great point. Training provided. You guys are touching on all the things we're going to talk about today. This is great. So yes, what kind of training do they offer? Is it free? Does it cost something? What kind do you need? Support, that's a big one. You're going to be using this every day. You're going to need support. So how is their support line? That's another question you can ask other EMR users because they'll tell you honestly, right, whether their support is good or not. What features are needed? Yes, so what features do you need in your EMR? User friendliness, that's a really good one because it's going to take some time to adjust. And you don't want new users on your system to be really confused and it take a while because they'll give up. And they won't use it properly. Ask for a demo, yes, absolutely. Compatibility with existing hardware, love that one too. Yes, we'll touch on that too. Thank you, this was a really good brainstorm. I am impressed. We almost don't even need to go through today's session. We will, don't worry, but yeah, you guys could teach this yourself. So I'm gonna screen capture this. And I'll take these because we have a resource that we've created and we have a couple of resources we'll point you to, but we could definitely use your input on those. So I'll take these as suggestions and update our resources. as we might need to. So perfect, thank you. Okay, so now let's dive into the meat of things. So what we've done at ACT is we've come up with a resource that you can use with some tips for choosing an EMR. So it's a 2-page resource, and I'll point you to where it is once I've gone over the tips and tricks that are in it. So don't worry about taking detailed notes on what I'm talking about here, showing you on the slides. There is a resource that repeats everything I'm going to say and even more than that. But if you do have questions, please feel free to chat. I can answer them as we're going, and or even you can come off mute as well. That's great too. So essentially this document is split up into 4 different sections. The first one is shopping for an EMR. So how do you actually go about considering different EMRs? So number 1, and people already said this, is request a demo. So this is important because it allows you to see the product in action, so live. And then it also gives you that venue to ask your vendor specific questions about how the EMR functions. You'll also want to ask EMR vendors if they are connected to other parts of the healthcare system. So someone touched on this too. So for example, can you easily access Medcare from within the EMR instance? Is the EMR enabled for CIIC PAR? And if the answer is no to either of those, you'll want to ask if potentially in the future, there are considerations to integrate with these. It's also important to remember that you can negotiate your contract with your EMR vendor. So contracts, whatever your EMR vendor tells you the price is, you can probably negotiate something better. Rhonda, yes. Rhonda just asked if this will be made available. Yes. So I'm recording this session, and then I will post it on the Wolf Resources page after this, and I'll send out a message through the Wolf discussion board with a link to it. So yes, this will be shared. So yeah, in terms of the contract, for example, you may want to ask the vendor if they have any incentives for you to switch to them. So you can tell them, I'm considering different EMRs. Are there any incentives to actually joining yours? So that's important because cost is a big factor. Also make a list of your needs and wants. So you guys also touched on this in our brainstorm session. So this will help you compare the different EMRs and how well they actually suit your needs. So part of this could be recording, what are some of your pain points with your current EMR? What are some things you find really frustrating? And is there another EMR that can help with those pain points? That could be a big one. Another point about cost is consider whether or not the new EMR will ask you to pay for future upgrades or add-ons. So there may be an initial cost for the migration and actually signing up for the EMR, as well as monthly or yearly fees. But sometimes an EMR will upgrade and they'll expect you to pay for that upgrade, or they'll offer you an add-on, but you have to pay for that add-on. So that's something that you want to know right off the bat, because then you can plan for it. Okay, the next section in the document is about the migrating data. So it's important to consider how data will be migrated from your current EMR to the new EMR. So again, this comes down to cost. We're going to talk a lot about cost today. So what does it cost to migrate all of your data? And make sure you get specific numbers, like get a quote from the EMR vendor. You'll also want to do a test with the vendor. So say you've chosen a vendor and you say, yes, we would love to migrate data. You'll want to test the migration out first. So what we suggest is picking 3 complex patients. So this means patients who have lots of labs, lots of referrals, lots of meds, lots of notes, etc. They have a lot in their chart. And then do a test migration just with those charts and see what the charts look like in the new EMR. So this will help you see if data is migrating properly, if some data maybe does not migrate. Yeah, this will help you plan for when you do your broad migration to know, is there going to be a lot of data cleanup? And then lastly, you'll want to ask the vendor if there's anything specific that won't migrate. So sometimes a vendor just can't migrate certain things. And if that's the case, you'll have to plan time to input that information in the new EMR. Okay, the third section is planning for EMR transition. So some things to consider when you're actually planning. So someone talked about a plan. This is what you should consider in your plan. First of all is the timeline for transition. So you'll want to work with the vendor on this because they've done this before. So they can give you an idea of what the time and effort is going to be required. So you'll want to take into consideration things like holidays, downtime, any training that might be needed. And you'll want to communicate this timeline with your entire team so they're aware, they know what to expect. You'll also want to consider any training that can be done before you go live. So at this point, we suggest only doing basic training because if you do advanced training before even having the EMR in front of you and giving it a try, you'll lose all of that knowledge, most likely. So we say do some basic training before go live, that way you're prepared. And then when you go live, you can actually test out your basic training and have an idea of how to navigate the EMR. And you'll also want to consider costs of training. So again, that cost thing. Ask about costs for everything because sometimes the EMR vendor will not tell you outright what the cost might be. And then during your planning for transition, you'll also want to talk to your team about any permissions that you want or do not want in the new EMR. So when you're considering this, consider maximizing the transparency of the chart. And by that, we mean the people who can see the chart. We suggest that you allow most, if not all of your team members in the EMR to see patient charts, unless a patient has requested otherwise or there's a need for a certain chart to be private. And the reason we suggest this is because then you can have a real team approach to the use of the EMR and patient care. You will also want to consider making a list of your commonly used requisitions and templates. So in Wolf, this includes all of your exam templates because, and as well as your search templates. So your search templates, this includes your rules, will not migrate. As far as I know, I did do a Wolf transition years ago and those did not migrate at all. So we had to rebuild them all in the new system. So that's something to consider. So make a list of all of those, include all of your smart forms, and give that list to your EMR vendor and say, what can you rebuild in the new EMR? What can you not? So then you can plan accordingly and make sure you include everything in this list. So don't miss anything. Otherwise, you'll be one day going in your new EMR and you'll be looking for a form and it just won't be there. You'll also want to identify a super user in your clinic. So this person can receive extra training and they'll be able to support the team, especially during those first few weeks of implementing the new EMR. So this person should be able to support both staff and physicians after the implementation. And you'll see this will be very, very important, especially during your initial weeks. Standardization. So we like to talk a lot about standardization. And sorry, there's something. Diane Power, thank you. Yes, even 2 super users. That's a great idea. Yes, thank you, Diane. I'll add that to the document. That's a great point. And that's important because it's always good to have a backup. And I would say that's important for most things that you do with the EMR or most of your processes, right? Having at least 2 people who know what's going on. And that could be, let's say one of them isn't in the clinic, right? So you can alternate between always having a super user there. And it's, yeah, it might be a lot to expect a single person to know everything. So it might help to have someone else there too, to help them out. Thanks, Diane. Okay, so standardization in the new EMR. So when you're migrating to a new EMR, this is a great opportunity for you to discuss how you want to standardize it from the very beginning. So of course, we know that some of the data that's migrated over may not be standardized, but it'll be good for you to discuss how you want to standardize moving forward so that you get started on a good steps there. And then lastly, if you are currently using certain features that support your workflows, you'll want to ensure that the new EMR maintains or even surpasses what you're currently able to do. So if there are workflows that are really important to your clinic, you want to make sure you can do them at least as well as you currently can in your EMR. Okay, and I know I'm going through these really quickly, and part of the reason is that you will have the document at your fingertips so you can actually look through this in detail. I just want to leave lots of room for discussion. Okay, so the last topic that we're going to cover is tips for a successful EMR transition. So these are some additional tips, both when you're choosing an EMR and when you're actually doing the migration to the new EMR. So first, you'll want to make sure that you include everyone in the clinic during the whole process. This also means asking other clinics what they like or dislike about the EMRs that you are considering. So when you're doing this, remember that each clinic's context is a little bit different. So if a clinic really likes one thing about the EMR, that may not be something that your clinic will like. And the same happens with dislikes. So consider your clinic context versus their clinic's context when you do that. It's also important to schedule team meetings. So this will help ensure that you are getting that input from everyone. It'll also help to ensure everyone is on the same page and knows exactly what's going on. Part of why this is important is because change is hard. And this is going to be a big change. So you'll want to expect some resistance to change. We have a good resource on managing that in the document, but regular team meetings are helpful with that. So you can address concerns, you can make sure everyone knows what the plan is, et cetera. And a point to consider from Gabriel, how well can it support QI work? Yes, that's huge, because that's a lot of what we do. Yes, I love that, Gabriel. Especially if you're a practice facilitator, encourage clinics to consider that, right? Because they may not always consider that. And so I love that. Thank you. Okay, third, plan ahead. So this means that you need a plan in the first place. And someone wrote this on our brainstorm session. So for example, the clinic may need to close for a few days. And so you'll want to plan accordingly, right? And you'll also want to make sure that you adjust the plan as you go, because that will probably happen. You'll probably run into things that you didn't plan for. So make sure you adjust the plan as you need to. And when you do, make sure that everyone knows about those changes. And then the last thing is tell your patients about the migration. So the migration will cause some disruption to clinic flow, and patients will likely notice. So it's important that they understand why those delays are happening. For example, the clinic might have to close for a few days, or there may be longer wait lines at the reception desk while the staff are getting used to the new system. So be open with your patients, and they'll likely understand, and it'll make everything easier for everyone. So these are just a couple highlights of some of the additional tips that are in the document. So what I'll do next is actually point you to where some additional resources are. Okay, so additional resources. So if you go on the Wolf resources page, it's already on there. There's a new tip sheet called Considering a New EMR Tip Sheet. So if you go on that page, you can feel free to open it up. It's a Word document. The only thing is there is a disclaimer. So this document was created by Mia Cavanaugh, who is a consultant with the AMA Act team, and myself. And so it was based on some of the content that is already on the AMA's Selecting an EMR webpage. It was also created based on some of our own experiences working with clinics who are migrating. So because it's based on our own experiences and limited other resources, we can't widely distribute it as an ACT resource. So what we ask is just that you don't post it widely. So don't mass email it out to everyone that you know. Don't post it on your website. You can, of course, share it with clinics who are going through this or other PCNs that you think this might be useful for. But yeah, just don't widely distribute it. So that would be great. Now, once you've gone into that tip sheet, and we suggest starting with this tip sheet because it'll give you an overview of different things to consider. Once you've looked at that, then consider going to the AMA selecting an EMR webpage that you see here. So the reason that we say to start with the tip sheet is that the AMA's webpage is very detailed. And this is awesome because it allows you to really delve into things, and it has great tools on there, like an assessment tool for different EMRs, but it can be a little bit overwhelming at first. So visit the tip sheet, get an overview of what you're looking for, and then go into the details that you might need. And actually the link to the AMA selecting an EMR webpage is also on the Wolf Resources page. If anyone doesn't know how to get to the Wolf Resources page, I can always send you the links to the chat, so let me know. Okay, so that was a lot of information all at once. Hopefully it wasn't too overwhelming, but I figured instead of just giving you a couple of resources and saying, go at it, I figured I would give you a bit of an introduction and an overview to what is in those resources, and then let you go at it on your own. So now that you've heard all of that, are there any questions? Has anyone gone through migrations? Do they have experiences from that they can share? Is there anything else that you would like us to add to the tip sheet? We already have some good suggestions in the chat and from the brainstorm period. But anything else? And this is an open discussion, so if you think of anything else, then please ask away, and hopefully someone in the group can answer. Again, feel free to come off mute too if that is easier for you. Yeah, I agree, Stuart. So Stuart had a good point in the chat that he's surprised this hasn't been touched on. Yes, I am too, to be honest. And so that's why we put this session together. I know there was supposed to be Telus was going to put a session on before the holidays. That didn't happen, and I'm not sure when that's being rescheduled. So keep an eye out for that, because that could also be helpful. But yes, I agree. So hopefully this is helpful for you. And if I come across any other resources or anything else that I think might be helpful, I'll let you know. And if anyone else in the group can also do the same and just post anything they find on the discussion board, that would be helpful. And that's a good point, Stuart. That's kind of why this group was formed, right? Because we're not going to have all of the information, the resources that we need necessarily. So hopefully this group can help each other to actually gather those resources, right? And help each other. Okay, and while we're waiting for people to chat, I'm just going to send the link to the Wolf Resources page. So now note, to get to the Wolf Resources page, you need to be signed up for the network. So if you're not signed up for the EMR user network, then you'll have to go, and I'll send you the link to that as well. Okay, so I just posted the link to sign up for the EMR network as well. Okay, so we have some more chats in here. Plan. Yes, thank you, Nancy, for your change management for everyone from positions to pages. Absolutely, Nancy. So I know when I worked at the South Calgary PCN, we migrated 3 different clinics into a single EMR instance, and it took us probably about a year. So from planning to execution, and even beyond a year to actually get used to the new system. So Wolf isn't sunsetting tomorrow. It's not even sunsetting in a year. So don't feel like you need to rush into a decision. Take your time. Research things, research different EMR vendors, take the time to consider them. Some of our vendors may push you to try to make a decision quicker. You're not in a rush. Remember that. You have almost 3 years to decide. Not saying don't put it off to the last minute, start planning now, but don't think you have to do this in 3 months, 6 months. You have some time. Okay, Diane, can you elaborate on what this means for clinics that are already migrating to MedAccess and had their dates scheduled? Yeah, great point, Diane. So we know that a lot of clinics have already made their decisions. So I wish we could have done this sooner, but yes, some clinics have already decided to go to MedAccess. So what I would say is read through, sorry, Diane, can you clarify, are you asking if people can reconsider MedAccess or how they should plan for their migration? So if you have your date scheduled and you're migrating, I would say go to the tip sheet, go to the, even the AMA's website has additional EMR resources. So they have other EMR resources beyond just selecting one. So I would say go there and see what they have there. And even the tip sheet has some tips on migrating. So doing that test migration. Diane Power about Stuart's comment. So I don't know, Stuart, if you can answer Diane's question. While we're doing that, I will send the link. Sorry, did someone call off mute? Okay, so I'm giving you the link to the AMA Selecting an EMR page. If you go in there, you'll see some additional EMR resources. Okay, Kimberly, they're letting people choose between Input Health and MedAccess if you have already received a MedAccess quote, was what I was told. So Stuart, I don't know if you want to clarify what was in the chat. Yeah, this is something that I'm hoping some of you on the call can help clarify, because I haven't actually been in touch with Telus or those clinics that are switching. So I don't know if anyone has experiences to share right now.
Hi, sorry, I can chime in here if everyone can hear me.
Sure.
My name is Julie. I'm at Levita Medical in Airdrie. So we were we had a date of March 15th to transition over to MedAccess, and I got the call a couple weeks ago saying that they were doing, sorry, is it InterHealth? I can never remember.
Yeah, I know there's Input Health as well.
Input Health, yes, Input Health.
Yeah.
So they were swapping over to InterHealth, and their flagship product was going to be the CHR. So we could put this on hold, or we could continue. However, there was a possibility that we would have to change somewhere down the line again, that I was told.
Oh, interesting.
Yeah, so they didn't know when or where, and they didn't have a lot of information themselves, but they did say that it was a possibility.
Wow. So they told you that after you had already signed up with them, right?
Yeah, we signed up. So the contracts, they said if we don't want to go with them at all, they'll just tear up the contracts. That's fine. They are kind of pushing for signatures because of the 18-month waive of fees. And they said on the contract they'll just put CHR rather than MedAccess.
Okay. So that's good to know for anyone else. Yeah, that's, yes, Diane, you said it very well. I don't know how else to put it. Good grief. So thank you. Thank you for sharing that. Yeah. And thanks, Stuart. Stuart just put a link in the chat there to Input Health, more information. Diane, yes, this is a completely different platform. So Input Health, and if anyone has additional information, please chime in, but Input Health was recently bought out by Telus. And so now they're offering it as another alternative to Wolf. So it is a Telus product, but completely different platform from MedAccess. And I believe it is mostly used in Quebec. I believe that's what where Input Health is mostly. Ontario and BC. Thanks, Kimberly. Oh, wow. Thanks, Gabriel. Yeah, it sounds like they might even be migrating med access clinics to Input Health. 3 to 5 years. So what do you mean by that, Ruth, a collaborative health network? Is that what Input Health is? You probably clicked on that link, Ruth, so you probably have more information than I do. So yeah, that's something to consider is if you're considering EMRs, if you're considering med access, consider if potentially you might have to migrate over to a different EMR eventually. Oh, collaborative health record. Thanks, Ruth. Yeah, so these are all good questions to ask directly to the vendor and ask for specifics, right? Ask for things in writing. Because I know this is hard. Like, it's already a big change for clinics to make, and then suddenly they're throwing all these curveballs. So get as much information as you can right off the bat. And what I'll do is I'll save this chat when we're done, and if there's any, I'll put this additional information somewhere so you can all have access to it. Yeah, I completely agree, Diane. I know if I was a clinic considering a different EMR, it would definitely make me consider, you know, do I want to switch to this other EMR when they're throwing curveballs like this at the last minute? I totally agree. Yeah, switching EMRs is not something you want to be doing very often, if ever. Yeah. Does anyone have any experiences with any other EMRs in the province? So I know we've talked about Ava in the past. There's a Curo, anything else, HealthQuest. I don't know if anyone has Telus experience. Oh, cocky. Thanks, Angel. Do you have any experiences to share with that?
I haven't actually looked at it or tried it out or even, you know, done a whole lot of poking around, but from what I understand, it's created by some Indigenous groups who wanted to have something a bit more tailored for their own experiences in First Nations communities in Alberta. But apparently it's getting a lot of, you know, good feedback and good press. And I think they've published a few articles about it and stuff like that. So and I understand that there are some very initial talks going on about conforming Okaki for CIIC part. But yeah, that's about as much as I know about it.
Oh, interesting. Yeah, and I do remember that CIIC part was talking about integrating with them. So I don't know where that's at, but yeah, that's good to know. I thought they were only an Indigenous kind of EMR, but good to know they're also available.
Yeah, I mean, I think they're mostly being used currently on like in First Nations health, but I don't think they have to be exclusive. You know, I think it's usable for all sorts of different types of clinics. So.
Oh, cool. So Diane says, as a PF, how would we have heard about this other than from our clinics? Was this reviewed to this group? What do you mean by this group, Diane? Like the EMR network group? So I'm not sure what you mean by reviewed. Yeah, as a PF, that's a good question. So I don't know if you're talking about the PF network, if that would have been somewhere to discuss this. Anywhere. Yeah, and that's the problem, right? I think this was a curveball for all of us. And so that's why we're trying, we held this session because it seemed like at previous, I'm surprised as well, to be honest, at previous meetings, I was surprised to see so much discussion about how do we choose an EMR? How do we do this and that? So I think we've been trying to respond to that need. I know it hasn't been as timely as we would have hoped for, so I apologize for that. But yes, that's a great point, Diane. Yes, thank you, Angel. We are trying to share information as we get it. And I think that brings up a good point about this group being, this is for all of you, this group. So it's not just about me or other ACT members sharing information with you. It's also, hey, if you need something, let us know. Because otherwise we're just guessing or we're going based on some of the chats in the meetings. But we want to know. You guys can start your own chats too. If you're missing information, post it on the discussion board, bring it up here. Yeah, we can have some of those difficult conversations, right? And this is a safe venue where everyone can share without fear of, other people putting in their input, like the vendors or, physicians or whoever it might be. So yeah, I'd encourage you to really leverage this group and let us know what you need. Yeah, and that's right, Angela, even rumors, because we don't hear these things from the clinics either, right? So we can give you information that we're hearing from up top. And honestly, we don't hear all that much information from Telus. But yeah, if you hear things from clinics, we would love to know, because then we can share those things here, right? So hopefully that's helpful, Diane. Yeah, I apologize that you have not been more in the know. Unfortunately, we haven't been either. So hopefully we can work on that in the future. Tanis, as far as I understand, yes. So there is an FAQ, I believe I put it on the Wolf Resources page. Telus did put out an FAQ for clinics who were wanting to switch from Wolf to MedAccess, and I believe in there they did say that they would cover the cost of that migration. So if people are hearing otherwise, please let us know, or they should be questioning Telus about that. And I actually haven't posted that FAQ on the Wolf Resources page, so I will do that so you can take a look at it. So anything else that people think, yeah, Tanis, if anyone hears the latest news on this, please put this out to this group so we all know. Yes, thank you, Tanis. So yeah, if anyone hears anything, whether it's just talking to a vendor and they hear about a certain promotion or whatever it might be, or issues with dealing with a certain vendor or whatever it might be, please post it on the discussion board, share it with the rest of us. And I'll do the same from our side as well. All right, so I'll wait one more minute to see if anyone else has anything else to share. And of course, if you come up with anything after this, you can reach out to me. I'll have my email address later in this presentation. I'll also send it over in the chat. Or you can post something on the discussion board. Feel free to do that as well. If you want to remain anonymous, you can also send an email to the networks at albertadoctors.org email address and just put your input there. Just let them know you want to stay anonymous. Okay, so So future meetings, what can we expect? So we have a meeting booked on Wednesday, February 17th, and this will be some CIIC PAR updates as well as some Q&A. So we're going to have Barb McCaffrey. She is the project lead for CIIC PAR, so she knows all there is to know about CIIC PAR. So she'll be there giving you updates about that, and we'll have a Q&A session as well. Now, it may seem weird to want to go to that if Wolf is sunsetting, but it can be very useful because Wolf clinics are already signed up for CIIC PAR, and this may affect or will affect their migration to a new EMR. We're also encouraging Wolf clinics who are not switching EMRs until maybe next year to still sign up for CIIC PAR because they'll automatically be still on CIIC PAR when they migrate to a new EMR. And then we also will be doing a session on panel processes and the COVID-19 vaccine rollout. So we know that the vaccine rollout is coming fairly soon for people besides the important groups that are being vaccinated currently. So we'll have a session on how clinics can prepare for this through their panel processes. And then I also have not forgotten, I know we had a discussion about this back in the fall about having a session where everyone can not brainstorm, but everyone can share which initiatives they're working on in their clinics or their PCNs, so that they can maybe share some tips and advice and that kind of thing and know who they can reach out to for help on certain initiatives. So I have not forgotten about this. The problem right now is that we're dealing with a lot of other emerging issues and things like that, but I have not forgotten about that. So if there's anyone actually who's interested in leading that conversation, please let me know, and we can have more than one person. What we're trying to do is shift this group from being an information dump kind of group. I know that those are important and we'll keep doing those, but it would be nice to also have our user group meetings be more open, where people can actually share what they're doing, and people can ask them questions, and we can have open discussions, and we can have actual group members from the group lead these sessions more. And part of the reason for that is that we at the AMA only see certain things, and yes, we can give you some high-level information, but you're the ones actually in the field. And so you have all of that valuable experience to share. So I think that would be extremely valuable for other people in the group. And thank you, Stuart. So Stuart actually put in the chat the link to the Wolf to MedAccess FAQ. So thank you, and I will post that on the Wolf Resources page as well. Okay, so that's it for today's meeting. Thank you so much for joining. Hopefully you gained some tips and tricks from today, and hopefully you can go back to clinics with some additional information that will help this extremely daunting process a little bit easier. If there's anything that I missed today, anything else that would be useful, please reach out, post on the discussion board, email me, email the network's email that's here. I look forward to our meeting in February. Thanks all for joining.